Welcome to a solo episode of the Forgiven Nutritionist podcast, where today I'm talking about the one question that psychiatrists, therapists, and doctors should ask every patient, but they don't. What is that question? Well, stick around and you'll find out. So, depression, anxiety, brain fog, ADD or ADHD, headaches, or even your balance and coordination. What if everything that you have been led to believe or led to think about these things is wrong? The unfortunate thing about some of these things is that they are either a symptom of something or that a diagnosis uses a set of these symptoms to diagnose, which can be very misleading. And for example, there are many things that can cause depression. And the symptoms tell you nothing of the actual physiology that is going on in the body and brain. Then what happens is your physician can accidentally calm down an already underactive brain or stimulate an already very active brain. When you look at the physiology, you can literally see the brain and see that if it's had a brain injury or if there are toxins in the brain like mold or Lyme. And so the reason I'm mentioning this is because recently I had a SPECT scan done at the Amen clinics. What is a SPECT scan anyways? I had not heard of it until a few years ago either. And SPECT stands for Single Photon Emission Computed Tomography. The Amen clinics uses a 3D SPECT. There are many SPECTs at other hospitals, but the Amen clinics uses a 3D SPECT. Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. BrainMD nutraceuticals are high-quality supplements specifically designed to support and enhance brain health. Developed by Dr. Daniel Amen and his team of experts, these supplements use carefully selected ingredients backed by scientific research to promote cognitive function, mood stability, and overall mental wellness. BrainMD's commitment to purity and efficacy assures that their supplements provide targeted nutrition for the optimal brain performance and long-term brain health. Be sure to click my link in the show notes. Dr. Amen says that the SPECT is kind of like a map, and I know that we all use maps, but it kind of tells you where you currently are and where you want to go, and that can kind of help point you in the right direction. The whole point of the SPECT scan is to see the areas of your brain that need help so you can start working there first. The SPECT scan shows you the areas of your brain that are working too hard and that are overactive or working too slow and are underactive. It can give you a lot of information on blood flow and oxygen to your brain. When someone has had a SPECT scan, it provides a detailed information about how the blood flow and activity in different areas of the brain. This imaging technique will help doctors evaluate the function of your brain rather than just its structure or how it looks. It can reveal things like patterns of blood flow that may indicate areas of abnormal brain activity, which can be associated with various conditions, such as cognitive disorder, mental health conditions, brain injuries, seizure disorders, and even infections, like I mentioned before, and inflammations affecting the brain. By analyzing and looking at these SPECT scan results, healthcare providers can make a better understanding of how the brain is functioning and make better informed decisions about treatment plans and interventions to improve brain health and function. And so much of the time, this does not include medication. I encourage you to go back and watch this video on Spotify later on if you are not able to watch it, or on YouTube, for example, if you're driving, because I'm about to play a clip where the doctor is literally pointing to different areas of my brain in the scans that they have done. And this will kind of give you a better understanding of not only how my brain works, but yours too. And normally at Amen clinics, they do things slightly different, but because I was not a traditional patient, I was just an employee doing this for this podcast and for an example at the Amen clinics. They did it a little more informally. So just know that if you're a patient, you get a much more formal and informative evaluation. So like I said, I encourage you to go back and watch this video because during this video, that recap that he kind of goes over things, He's going to talk in detail about different areas of my brain, and he's going to literally point. So that will help you know which parts of your brain do things. Here's the clip from my evaluation.
Okay. All right. So basically, this is your frontal lobe, right? So your frontal lobe is focus, concentration, executive functioning, processing speed, impulse control. So if you have any issues in those areas, that is why you have issues in those areas. So we want to do things to help improve the functioning of your frontal lobe, so we can talk about that. Your temporal lobes, so you can see there's this indentation here, right? So just to explain it a little bit more, right? So everybody knows that is not a hole in your brain.
Right.
Right? That just represents that area underneath your frontal lobe is not picking up the tracer as well as these smooth areas, right? So the tissue there is underfunctioning. So therefore, more likely than not, you're going to have some difficulties with some of the functions that the frontal lobe modulates. So the most common thing with this would be focus and concentration, maybe some processing speed, maybe some impulse control things, too much shopping at night on Amazon or something like that.
Luckily, I'm good there. So
Okay,
I've
good.
improved that.
All right. These are your temporal lobes. So you can see this like indentation here. So it looks like there's decreased pickup of the tracer there, and the shadowing a little bit in here on the side. So your temporal lobes have some decreased, functioning, especially on the right side. So temporal lobes modulate emotional reactivity. Like, do you react really strongly to things? Like on a scale of, when a scale runs from 1 to 10 and you should hit 10 when something upsets you and you really hit 50, that's a temporal lobe issue. Mood stability, people whose moods fluctuate a lot, that is temporal lobe modulation. Temper, the nickname for temporal lobes is temporal lobes, right? So if you have a hot temper, that could be modulated by temporal lobe functioning. Then other things like anxiety, fear, phobias, deep, dark, negative thoughts. That would be an example, like when somebody's really depressed, they have thoughts about suicide, or they're always beating themselves up. And then some short-term memory problems one could have from temporal lobes. You have a little bit of decrease in your cerebellum. The cerebellum is the CEO of the brain. It oversees and modulates everything. It's like checks everything, but it's also very linked to the frontal lobes. So again, it's involved in focus, concentration, executive functioning, processing speed, impulse control. Sometimes it's tough to know whether, in this case, more likely than not, your cerebellum is decreased because of whatever is affecting your frontal lobes. That's the likelihood. You have a bunch of bumpiness. We call it scalloping. So why might somebody have scalloping? So that can be from, it's not severe. It could be toxins, infection, inflammation, sleep, not really sleep apnea. Usually sleep apnea you'd see more here. You don't really see that much.
I do have mold.
Mold, hormonal abnormalities. These are all the things that can cause scalloping. And again, I can't tell you what the cause is. Right. I can tell you, I see these patterns, certain things we know cause these patterns.
Right.
So if you've had mold and you have that, more likely than not, that's from mold.
I'm working on detoxifying that right now.
Okay. Have you had head injury?
Yes.
What's happened to you?
I've been in several car accidents.
Okay, good enough. So you look like head injury. Why? So you have small areas of decrease all the way, really, you're a little flattened out there too. It should be a little bit more arched. So you have little decreases in your frontal lobe, your temporal lobes, your cerebellum, up parietal lobe a little bit, and occipital lobe. So what happens is, your head gets jarred. You don't even have to have a concussion. Your head gets jarred. That is the consistency of butter in a hard shell. So your head gets jarred, your head stops, your brain hits the surface of your skull, it gets injured, your head jerks back the other way. Same thing happens on the other side. That's called a contra-cru injury. And then what I can't show you here, because I don't have my skull, is what your brain sits in. Right, so the base of your skull has all these ridges, very sharp areas and ridges that your frontal lobe, temporal lobes, and cerebellum are next to. So you get an injury, your frontal lobes rub against bone and they get injured, your cerebellum bangs against bone and it gets injured. Your temporal lobe bangs against bone and gets injured. Your cerebellum rubs against bone and gets injured. So possibly mold. This also could be from head injury, right? Because of the things in your case, that's the most obvious is, mold is based on tests. So tests can mean a lot of things. Head injury is head injury. Like there's no doubt you had head injury, right? So that can be head injury, and I would suspect that this stuff is all head injury. So really the treatment that I would recommend for something like you for this would focus on brain health optimization.
Okay.
All right, now let's look at your other scan. What the base of your skull looks like. Ridges, so this is all your brain rubs against that if there's a lot of torsion, right? So half my cerebellum's gone. So your cerebellum rubs against bone, your temporal lobes bang against bone, your frontal lobe rubs against bone.
That's so interesting.
So that's what's happening.
I think everybody thinks that this is nice and smooth on the inside.
It is smooth, except for the sharp edges.
Right.
And the ridges sticking out. I actually have to mark, I got to mark that with pink so people can see it. All right, this is your active scan. So what do we see here?
The cerebellum.
So this should be very white. So in the picture we just looked at, color doesn't matter. In this picture, color matters. So you want to see a lot of white here. Your cerebellum should be the most active part of your brain. It should be picking up the most tracer. So you don't see a lot of white here. So your cerebellum is somewhat deactivated, which is what we see with head injury, right? Your limbic system is overactive. Your thalamus, that is the modulator of mood stability, depression, deep, dark thoughts, sleep difficulties. So any mood difficulties you're having, it's probably because this is overactive. Your basal ganglia is somewhat overactive, so that's going to modulate anxiety. You get a little bit of extension, most likely it looks like in your temporal lobe. So when I see temporal lobe abnormalities and overactive thalamus, more likely than not, you're going to see some people who have some mood regulation difficulties. So that's what this scan shows. Now, the question in your case is, how much of this is really a consequence of head injury? So the answer to that for most people ends up being, so did you have certain mood problems before head injury? And if you did, then your head injury is aggravating this problem and not causing the problem. There's some people who, they had no problems at all before they got a head injury. They get a head injury and now all of a sudden, terrible depression, their moods are completely unstable, and then the head injury caused the problem.
Right, yeah.
But the way to figure out the difference is, did you have similar problems before the head injury? And then that the head injury isn't the cause, but it more likely than not is aggravating the problem. So it comes back to, you want to maximize, you want to manage you want to calm this down and manage symptoms an individual has. But the long-term goal is you want to maximize your brain health.
Yeah.
And that's it.
That's what I'm trying to do.
So there you go. That's my interpretation of your scans.
Awesome.
Did I hit it on the? Did I hit it on the head? It is so on the head, right? It's so funny that it's really, these scans are not diagnostic, but I've looked at many people's scans, especially like staff members and everything. They'll come in, I'll look at it, I go, do you have this problem? Do you have this problem? Do you have this problem? They go, yes, yes, yes. So the scans are actually very predictive of difficulties you're going to see people have. So there you go.
I can only imagine what they used to look like, because now I don't
probably
experience any
way
of the
worse
depression or anxiety like I used to.
Right.
But yeah, I would have been totally all on fire before.
Yeah. So brain health for you, besides all the things you're doing, You really want to maximize your nutraceuticals, right? You really want to maximize your fish oil. You really want to think about HBOT and doing more of it. You want to think about photobiomodulation, near infrared light. So this is something new that they're looking at, and so they've used it for years for like skin conditions. But there's also more research coming out that the right devices with the right frequency actually penetrate skin and bone and helps with tissue healing in the brain. It increases mitochondrial functioning in the brain, right?
Okay.
So a lot of people are now looking at this, and you can get these devices for $2,000 to $4,000. You basically wear them 30 minutes every day. So for people who can't afford to do HBOT, this is the second best option, and because it's affordable.
Right.
And it's easy to get. HBOT can be difficult to find a place to go or have the time to do it, because it's like 5 days a week, 40 treatments, sometimes more than 40 treatments. You can buy them, but for your home, soft chambers, but they're still costing, $6,000, $12,000 for a reasonable device. So they get fairly costly. So the photobiomodulation.
Is that the same infrared in the infrared sauna?
No. So yes, it's infrared, but it's not the same wavelength. So people ask me this all the time. Well, does infrared sauna work? No. Infrared sauna is great for detoxing. It's not going to help with brain health.
Okay.
Right. I mean, it'll help with brain health because it's detoxing you, but it's not going to have a direct effect on brain health.
Right.
So
the ripple effect, right?
Right. So there are 2 or 3 companies now that are making, devices that they've shown to be effective. They've also looked at this. Harvard's done studies with near infrared lights for depression.
Oh.
So yeah, they're very interesting. It's new and upcoming.
I'm guessing it's not the same infrared light that's at the Planet Fitness too.
No. But dermatology has been used near infrared light for years to help with skin conditions, right? Because it does help with tissue healing.
Okay.
So anyway,
All
those
right.
are my thoughts. That's your brain.
Thanks.
Show your brain up front now.
Okay, so the first part, he talks about my underfunctioning frontal lobes. And again, he mentioned that this is part of your brain that's responsible for judgment, impulse control, focus, concentration, executive function. And some people, until I started working at the Amen clinics, I wasn't really familiar with what executive function is. So those types of things help you manage your time, help you pay attention, plan, and organize, remember details, and multitask. So this is usually the area of brain that will definitely reflect if someone is experiencing ADD or ADHD. This is also the part of the brain that doesn't even finish developing until you're about 25 or 26. So that means it's the last part of the brain to stop developing. I think that a lot of people don't really realize that, and I didn't again, that your brain is still developing until you're about 25 or 26. It doesn't just stop. Your body and brain doesn't just stop when you're born. You can kind of think of that part of your brain as your Jiminy Cricket. And some of the things that can really help this area are omega-3s. Pretty simple, right? Just omega-3s. Another thing that you can do to help is boost dopamine, which is exercise and eating a high protein diet. Those things help boost dopamine. Nothing fancy is needed. No medication is needed. There are also some awesome ADD and ADHD or executive function coaches out there that can help you learn some tips and tricks to work with your brain instead of against it. Again, all without medication. And this doesn't matter what your age is either. It doesn't matter if you're 11. They have executive function coaches as well as ADD and ADHD function coaches as well for that. Again, without medication. There are nutraceuticals that can help too, but that gives you an idea of how simple addressing that area of your brain can be. The next spot that Dr. Easton kind of talks with me about is my temporal lobes. Those two are underfunctioning. The temporal lobes are responsible for learning, reading, anxiety, phobias, short-term memory, mood stability. It helps modulate your emotions or regulate them, your temper, social cues, and even language. This is also the spot that's in your brain could cause headaches, which I used to suffer from terribly bad for almost my whole life. Oddly enough, it can also be the spot of the brain that could be altering if you have tummy troubles. So think about that. I know someone with tummy troubles a lot. So this could be the spot of your brain that really needs fixing too. And a lot of people don't realize how much the brain is responsible for the how your body feels. It could be your temporal lobes are needing some TLC. So a little tip about the temporal lobes too. Dr. Easton mentions my right temporal lobes are underfunctioning. Well, those that have left temporal lobes that are hot underfunctioning, they usually have evil thoughts or really dark thoughts. But the right can still have it. It's just usually more the left side. Now, some things that can help with temporal lobe issues are, again, omega-3s, belly breathing, which if you're not familiar with that, I know I mention it a lot. It's definitely not breathing through your chest. And most people nowadays, they breathe through their chest. So you want to breathe through your belly like babies do. That's a whole other podcast episode. Eating a balanced diet or ketogenic diet, and even neurofeedback. If you aren't familiar with what neurofeedback is, you can check out my podcast episode, which is 38, that recently aired. It's a very simple procedure that really kind of helps your brain get trained so that it uses the right roads again. Remember how Dr. Amen mentioned that the SPECT scan is kind of like a map? Well, this helps you to drive on the correct roads again, almost as if instead of you're using a detour now you want to use the correct roads. Another nutraceutical that really helps this part of the brain for both focus and also memory is phosphatidylserine, or PS, some people just call it. Just for these two areas of the brain that I've talked about so far, I take omega-3s. I also take that nutraceutical called NeuroPS, which is the phosphatidylserine. I do belly breathing, and I exercise at the gym 4 times a week, and I even walk or even bike almost daily. I eat a balanced diet, which includes only these areas, which are protein, fruits and veggie carbs, and it's full of healthy fats. So it definitely kind of gives that ketogenic diet feel to it. Biofeedback can also help the temporal lobes. Now, my cerebellum is very underactive as well. The cerebellum is only 10% of your brain, but it houses 50% of your neurons. This area of the brain should be the most active. It's kind of like your CEO of the brain, so it's pretty important. It's responsible for coordination, both physical coordination and coordination of your thoughts, or how you kind of process things and get things out. It involves the ability to integrate various mental activities, such as reasoning, memory, and attention, in a way that allows you to clearly and effectively communicate, plan, or act out on things. The right side of the cerebellum is involved in attention, empathy, and the right side is also involved in organization. Some things that are great that help the cerebellum are coordination exercises, like table tennis. Dr. Amen talks about table tennis all the time. But pickleball is another great one, which a lot of people at my church are involved in pickleball, as well as I guess that's one of the hot games that's out there. But I do practice balancing almost every single time I'm at the gym. I practice several different ways, and they all involve being like on one foot or one leg. That's a really great way, just simple way to practice your coordination and really utilize your cerebellum. Another thing that really helps your cerebellum is a simple practice of just practicing gratitude. And yes, it can be that simple. Finding things throughout your day to be grateful for. Simple things, big things, just look for them. And of course, yes, nutraceuticals again. My limbic system, or the thalamus, is actually overactive. This is the part of my brain the first part of my brain that the doctor mentioned that's actually overactive. The other ones were underactive. This one's overactive. The limbic system kind of sets your emotional tone. It's also where your libido, bonding, and your sense of smell actually comes in, and where all your charged memories come in. It plays a role in sleep and appetite. So when it's overactive, you can have really dark, negative thoughts, low motivation. You can be sad and moody, and you can kind of be socially isolated. This is the part of the brain that gets active when you are around your friends. You become more sensitive. This is also the part of your brain that kind of lights up when your mom criticizes you, and that can fire up when grief really kind of sets in here. However, it's also the spot where you bond well with a pet. And some simple things that can help you with your limbic system are exercise. Again, exercise. Nutraceuticals like omega-3 fish oils and saffron, both of which I do and take. Another thing that really helps your limbic system is smelling essential oils. Two in particular that really help with that are lavender and vanilla. And I love essential oils. I did do an essential oil podcast. It was one of my first ones. I'm going to say, I can't remember what it was. I think it was 10. I think it was episode 10. And they can be very therapeutic and healing. They have been used not only in Chinese medicine for thousands of years, but they were in the Bible as well. And yes, the limbic system, biofeedback can also help this. My basal ganglia is also overactive. The basal ganglia is kind of responsible for either giving you that sense of calm or the sense of anxiety and creating tension and nervousness. It can also cause addictions or tremors and tics, kind of like Tourette's. Another thing that the basal ganglia is responsible for is smooth movement, which is handwriting. That's kind of a great example. This is something that in recent years for me has really changed, and my handwriting has gotten so hard to do, like literally hard to handwrite something. It's definitely not smooth by any means. Some people, when they have this area active, they kind of predict the worst. And maybe you know someone like that. Do you know someone that predicts the worst or automatically thinks negatively about something? Something super easy that can help with an overactive basal ganglia like mine is, again, belly breathing and breathing exercises like meditation. I downloaded a meditation app, and I use this meditation app on my Oura Ring also. Because the Oura Ring app, they have a lot of great meditations. But yeah, I downloaded a meditation app and I do these almost daily. It's so helpful and such simple things to implement. And again, a lot of times they're free. Nutraceuticals for the basal ganglia that I take are magnesium, and I also take GABA, which is a neurotransmitter that's essential for brain health. Also, something that can really help in this area of the limbic system and temporal lobes that I mentioned before is biofeedback, which really helps with stress. This is something new that's in my practice. I now have biofeedback, and I help people like myself to become more resilient and to train your body and brain to get back in alignment. I did do a podcast again about neurofeedback, which is number 38, which is similar to biofeedback. And I suggest you listen to it if you haven't already. At the end, Dr. Easton kind of talks about how important nutraceuticals are. And he called them nutraceuticals. And anything that I take is a nutraceutical, but here's some information just so you kind of know the difference between a supplement and a nutraceutical. Supplements, the definition of a supplement is that it's a product intended for nutritional value to add nutritional value to the diet. It usually contains one or more dietary ingredients such as vitamins or minerals, herbs, amino acids, or other substances. And the purpose is to primarily use to support overall health or fill in those nutritional gaps, which are great. The nutraceuticals, however, the definition is it's a broad term. It refers to any product derived from food sources with extra health benefits beyond the basic nutrition value found in those foods. This term is a combination of nutrition and pharmaceutical. And the purpose of these nutraceuticals is they are not just to supplement the diet, but also to prevent disease and enhance health and delay the aging process. That's why nutraceuticals are much more important and play a bigger role than just a supplement. Because supplements don't really help. I mean, they can sometimes in a roundabout way, but the nutraceuticals definitely go right in and they prevent the disease, enhance your health, and delay that aging process. I tell you this because they do make a difference, and there's a big difference just between the two. That's why I kind of like Full Script, which they sell BrainMD. which is Dr. Amen's brand, and they have good quality nutraceuticals and supplements. And you kind of know what you're getting and what you pay for. And when it comes to your health, especially your brain health, don't you want pure ingredients? I don't want synthetics. And don't you want something that works well in your body and brain? After he talks about those nutraceuticals, he also talks about hyperbaric oxygen, or HBOT. And again, I just had a podcast episode number 36. So if you haven't seen that podcast episode, that episode is all about HBOT, or hyperbaric oxygen therapy. Hyperbaric oxygen brings pure oxygen to the cells in the plasma, and that's what my brain is kind of showing. There are some areas that are underactive that are probably not getting the oxygen it needs. Elevated oxygen levels allow more oxygen to reach the tissues that are otherwise oxygen deprived due to injury, inflammation, infections, like I mentioned, Lyme and mold. And these all help preserve brain tissue and accelerate the healing. Another thing is infrared light. This will create ATP, which is the energy of the mitochondria in our cells. Those are like the little battery packs, I guess you could call them. Yeah, they're like the powerhouses of our cell. They boost in cellular energy, which can support brain function and repair. It improves blood flow, which means more oxygen and nutrients that are delivered to the brain tissues, which is critical for cell survival and function, especially in affected areas due to that are injured or are having problems from disease. It also creates new neurons, which is critical for brain repair. And remember I said the cerebellum has 50% of your brain's neurons? And remember how my cerebellum is underactive? Just this type of treatment, that infrared light, can make a huge difference just in my healing. Remember at the beginning where I said there was one question that psychiatrists and therapists should ask, and doctors should ever ask every patient, but they don't? They should ask, have you ever had head injury? Well, I had head injury, several in fact, and never was the first one helped properly. So when I got another one, that just made things worse. So when I got another one, it made it even more worse. And I can say that after each head injury that I can remember, I can pinpoint some behaviors that worsened, and my moods and my behaviors, they all worsened every time I got another head injury. And I did things in my life that I normally wouldn't do. At the time, I definitely acted out towards my husband and towards my kids. Just my attitude and my risky behavior and my lack of feeling anything and my depression and low moods and my low motivation. And again, all that could have been avoided had my head injury been addressed properly the first time, and then properly the second time, or even the third time. I can say that I remember thinking and feeling like things were off before I remember my first head injury. So did I already have a head injury that I just don't remember? Like, was I a kid and I fell out of a tree? Because I did used to climb trees all the time. And I do remember swimming at one point, and I remember swimming and I dove off of a diving board and I swam down and I hit my head at the bottom. Was that the head injury that could have possibly caused some things when I was younger, before the first one that I really thought was my head injury, which was a car accident? Or did I have other issues going on, like gluten? Was the gluten that I was eating causing some type of brain health issues? And then I got a head injury, and that made my already brain health issues even worse. Because I can tell you right now that if I were to eat chips or even a piece of bread or noodles today, I will definitely not physically feel well, but mentally I will not feel well for quite a while. So unfortunately, I will never know what caused or started this. But this is where my don't miss this moment kind of comes in. What I do know is that you are not stuck with the brain you have unless you do nothing. I am so glad that I finally get to change things, and I chose to change things because I am not stuck. I'm not stuck anymore, and I get to help others. And again, all of my issues can be helped without medication and the risky, horrible side effects that come with them. So here's the thing. If you want to take anything away from this episode, it would be this. You have options, and you are not stuck with the brain you have unless you do nothing. My t-shirt has a Bible verse on it is Psalm 66:5. And on that, that verse starts off with, "Come and see what God has done." And I encourage you to learn how God created your body and brain and see what you can do to help it or even repair it. Thank you for listening to this solo episode on the brain, or should I say my brain, but our brain. And please click the link in the show notes to set up your free 20-minute consultation with me if you are ready to start taking back your brain health. If you are looking for a trustworthy place to choose all of your supplements, FullScript has 285 different brands to choose from. They did the work for you to check quality standards for all the supplements they carry. These standards are important because they help to ensure a product is safe, effective, and accurately labeled. FullScript uses third-party companies to provide unbiased assurance that certain quality criteria are met when they add a company or product to their inventory. When you set up an account with FullScript, use my link and you'll always get 15% off your supplements. If you want to continue learning and hearing all things nutrition for your mind, body, and soul, click like, subscribe, or favorite me on whatever podcast platform you use, or you can find me at ForgivenNutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.